Okay, so good evening. The topic of this Learn and Share conference call is epilepsy and relationships. I'm Russ Derry, the Director of Education for Epilepsy Foundation of Michigan, and I'll be moderating the call. We're pleased to have with us as our speakers Courtney Kowalczyk, who's a pediatric psychologist at Horizons Developmental Resource Center, and Andrea Thomas, the psychologist for Comprehensive Epilepsy Program. So welcome, and thank you for joining us.
Thank you for having us.
Yeah. So can each of you start off by just briefly describing your experience with this topic? Courtney, do you want to go first?
Sure, I'd be happy to. So I am Courtney Kowalczyk, and just to give you a little background about myself, I started out actually working in the classroom environment with a lot of different children with special needs. I worked specifically with children who did have medical and health needs, so very familiar with epilepsy right from the beginning of my career. I slowly transitioned out into the world of pediatric psychology and have been doing this now for several years. I spend a lot of time working with families as a whole who are impacted by special needs, whether that be medical needs or other neurodevelopmental disabilities. And we do spend a lot of time actually talking about relationships and mending relationships and really supporting effective parent and child relationships in regards to how kids are able to relate to and be guided by their parents. And epilepsy in particular, we have spent a lot of time working with our families who are impacted by epilepsy, and how do we support really cohesive relationships, not only within the family unit itself, but reaching out to extended family members and friends, and really trying to build positive relationships across the board for everybody, because that support network is so important.
Right, absolutely. All right, great. Andrea, do you want to give us a little background?
I certainly will. I'm Andrea Thomas. I'm a psychologist with the Comprehensive Epilepsy Program at Henry Ford Hospital. And prior to that, I worked for many years for the Epilepsy Foundation of Michigan as a psychologist. And I have worked both with a pediatric population and adults, and currently that's still pretty much the same. I see kids and adults. I also do facilitate an epilepsy support group that meets once a month in Detroit. And certainly the topic of relationships is very important and a very common issue that people want to talk about and get help with. So and I'm very happy to be here tonight.
Excellent. Okay. So epilepsy can put a strain on any relationship, but it can also bring people closer together. And often the difference between these outcomes depends on the social and communication skills of the person with epilepsy and that person's friends and family members. Can each of you talk about some of the most important skills needed to develop and maintain healthy relationships in general, and then which of those skills are particularly important when epilepsy is involved? And just for the sake of continuity, Courtney, if you want to go first, and then Andrea, you can.
Sure.
Okay.
I'd be happy to. So when thinking about really looking at cohesive relationships and what are some of those important skills that we need to develop and maintain healthy relationships, for me in the work that I do, I really feel that the biggest area of focus and attention that we really need to look at is how are we effectively communicating with one another. Communication really, it really can be the binding that holds relationships together. It can also really break things down. And I find in the work that I do that really teaching and helping, whether it be children or adults, parents, individuals impacted by epilepsy, whomever we're talking about, I really feel that building good communication skills in everybody is important, because it's really important for us to be effectively able to communicate with one another, not only about some of the positives, but the negatives as well. And we have to be able to have good communication skills in that regard.
Great. Andrea, anything to add?
Well, I totally agree with Courtney about communication. And sometimes, the reason communication is a problem is because people forget that it isn't just about talking, it's about listening. And so often some of the issues that come up in relationships that create problems are the fact that somebody isn't listening to the other individual. So, that's a really important area to work on. I also think that one of the, the factors is it's not a skill so much, but, just the person's individual background, the family dynamic, the communication, trust, things like that have to be there on both sides. And, so sometimes, the focus is just getting people to be on the same page regarding, how well they communicate. And, there have been research studies that have found that people do much better in their relationships when there is open communication about the condition. And that means that both the individual with epilepsy and whether it's family, friends, caregivers are also educated and pretty much on the same page. So, the relationship ultimately has to be stronger than the disorder.
Most definitely.
Right. So people often think of social skills as some hardwired part of their personality and therefore have a kind of a defeatist attitude when it comes to the prospect of changing how they interact with others. Can you explain how social skills can, in fact, be developed and improved, and why it takes practice and time to do so?
Certainly. So, the amazing thing about development, brain development, or just personal growth is that can happen at any time and at any age. And in today's society, everything is moving so quickly. And we do see, especially in the work that I do, we see less emphasis at times on social skills and developing those and more on either concrete facts that we're learning or other areas. And so one of the things that I find is very important is to know that for everybody, whether we're talking about parents or caregivers or children or young adult experiencing epilepsy, there are so many different skills that we can build upon and we can learn, especially in regards to social skills. And how do we interact with other people? How do we advocate for ourselves or advocate for our children? How do we develop those skills in a positive direction? And that can really be done at any age. We spend a lot of time in the work that we do really working on those skills kind of one step at a time. How do we develop effective communication? Andrea was talking about listening earlier, which is such an important communication skill, but also social skill in general. How do we just listen, and how do we interact in a back and forth manner, and how do we build those social skills? We spend a lot of time going at that step by step and helping everyone really reinforce and build those skills. So that way we can develop more effective communication, and we can certainly see relationships taken to a much deeper level as well. This process does take time, though, and that's something that I know for a lot of individuals can be very frustrating. We can't just change our social skills overnight. That's not something that realistically happens, but certainly with time and practice, we can make really nice improvements with those. And we find that then has such a positive return, not only in the cohesiveness of relationships, but really being able to build relationships at a deeper level, a more meaningful level, so that everyone can get out of those relationships what they're looking for.
Great. Andrea?
Yeah, I totally agree with that. I think a lot of times there is such a pressure connected with that whole area of relationships, And if people have, for example, low self-esteem, if they don't have a strong sense of identity, then they worry more about what other people are going to think about them and how they're going to come across when they're trying to communicate with others. And sometimes that kind of pressure can make people basically present a side of themselves that's not necessarily how they always are, but they feel this need to, I have to say this, I have to, do that, I have to look this way or that way. And, it takes time. Everything is a process. I say that over and over to my patients. Like, there is no quick fix. If you're trying to change something important, you have to give it time. You have to be patient because it's practice that makes the difference. You don't flip a switch and change your personality or, change your mood or anything else. You have to become aware, first of all, and a lot of times people are not aware of how they do come across to others, and that there are certain things that need to be developed and improved. So, the time and the practice is really important.
I just want to build on top of that, too, because I completely agree with that. And I also think that when we add in the component of epilepsy, I do think we see at times some elements of fear and anxiety that also can impact social skills and being able to support others in working through that process so they can be themselves around the people that they love or the people that they want to get to know. That's definitely a process in and of itself as well that we have to support and build as well.
Right. And
sure, yeah.
Andrea, you mentioned, I think, a really important point is that to be able to make a change, you have to be aware of it, of the need for one, and that's a really tricky situation when someone, because self-awareness is itself kind of a social skill. Your ability to imagine and see yourself from afar and how others are reacting to you, and read social cues and that kind of thing. And if someone is lacking in that self-awareness, and they could really benefit from developing some social skills or improving some social skills, how do you get past the discomfort of making someone aware of that without really crushing them or making them feel terrible about themselves by mentioning that they could improve in a certain area?
Well, I can think of a particular patient that I saw a few years ago, and he was very focused on his epilepsy as being the reason why he was not successful socially. And he basically, as he talked, you could get this very strong impression that he saw himself as not likable, and really kind of anticipated being ignored when he got into any situations. So I asked him one time, well, what happens? Give me an example. And he said he'd gone into a little convenience store or a drugstore, and the cashier didn't say a word to him. And I said, well, did you say anything to her? Well, no. And I said, were you making eye contact? Well, no. So I kind of said, well, the next time you go in, I want you to try to remember to look directly at that person, make eye contact, and then maybe just say hi, smile. And he thought that was going to be very, very difficult, but he actually did it and, was able to come back and say, well, yeah, and then she said a few more words and I said a few words, and so he had to really see that he was the one kind of blocking, any communication. If you're not looking at someone, if you're not responding to anything, they're not going to, really want to engage you in any kind of conversation.
Right. Right.
Mm-hmm.
And Courtney, do you have any thoughts
I think
on how to let people, make people aware of improvements they can make without hurting their feelings?
Sure, certainly. I think that example that Andrea just shared is fantastic. I do some similar things as well, just even looking at one area at a time in particular. Sometimes I think looking at all of these different social skills, it can kind of feel overwhelming. So even just breaking it down one piece at a time and encouraging patients to notice, over the next week, when you're out in public, how often are you looking at someone? How often are you making eye contact? And having them just track and chart that. Sometimes that can be really interesting and very enlightening for patients as well. I went through the last week and went to a bunch of different stores and didn't look at anybody. Or, I noticed that I was looking quite a bit and it made me feel really uncomfortable. There's a lot of good that can come out of even just really specific small assignments and looking at awareness and helping the individual to build that awareness that I think are really great strategies and things to try.
Right.
Oh, for sure.
So for some people with epilepsy, associated conditions like autism, traumatic brain injury, or intellectual disability can affect social skills. And then also people whose epilepsy involves the frontal lobes may struggle with social skills due to problems with executive functions. And executive functions can include things like impulse control. So, that is something you might hear is people have a problem with a limited filter. So they, say the first thing that comes to their mind without thinking it through first, or problems with flexibility or adaptability or emotional regulation. Those all fall under that category of executive functions. People, again, particularly with frontal lobe epilepsy, might also have problems with attention, which is, as we mentioned earlier, really important in terms of active listening, which is an important social skill. So what are some resources and strategies that can help people with neurobiologically based social skills deficits?
It's a really, really great question, and I like to think about that with clients in regards to thinking about, in particular, how our frontal lobe works, how do our executive function skills work, and what happens certainly when those skills get impeded upon. One of the things, and one of the biggest things, whether I'm working with parents of a child, whether I'm working with the individual themselves, first and foremost, I think when we're looking at social interaction, we need to make sure that we're allowing enough processing time, even in just basic day-to-day types of interactions with others, making sure that we're allowing, if it's a child, for example, who is experiencing epilepsy, being able to allow that person to have some additional processing time to think through what's being asked of them, or even just in typical social interactions back and forth, that processing time piece is really, really crucial. And I see that when I'm doing work within the classroom environment as well. A lot of times we don't give people enough time to really process and think, and then they can feel overwhelmed or they can experience a lot of other difficulties. And certainly for anyone who's experiencing some type of neurodevelopmental and neurobiological deficits, being allowed to have some additional processing time in day-to-day conversations and even in the process of learning, I personally feel can be really, really crucial. I also do feel like in terms of direct therapeutic approaches, there's a lot of different things that we certainly can look at. Things like executive function training, really breaking executive functions down and helping people build those skills that they need. Certainly looking at social skills training and being able to build skills in that to and fro regulatory or reciprocity interaction process. Also really great ways to approach some of those big things. But I personally find the first and foremost go-to thing that I work on is just really making sure we're allowing people the time to think and the time to use those skills. And if that's a struggle, then we help them move forward and give additional support. But that's really the place that I like to start.
Great. Andrea?
Yeah, and I think I totally agree with that, and I think that along with that, it is, making sure that you are coming from the same place as the individual. I have a few patients who are high-functioning autistic, and certainly here in the neurology department, head injuries, and in addition to their epilepsy. So, you have to look at the total picture, so you're not just focusing on the epilepsy in isolation, but all the other things that go along with it or may have contributed to it. So when it comes to working with each patient, I've always been a firm believer in there is no one size fits all. Sometimes in therapy, therapists are so connected to one approach that's all they do, and they want it to work with everybody. And you can't do that. You have to tailor it to the needs of each individual. And there's so much overlap from other things. Mood. This is where anxiety and depression still, come into it. So there may be frontal lobe issues, attention deficit, but also some of the mood issues, that are going to play a role. And so, it's important to remember that this person has other things as well going on, and everything needs, it's all kind of interrelated, and everything needs to be addressed.
Sometimes we as therapists do end up in our little boxes of things that we go to, and it is so important, especially with patients who are experiencing multiple things, whether it's multiple neurologically based or neurodevelopmentally based disabilities and or other medical conditions like epilepsy. Sometimes we just don't fit into a box, and I completely agree with you. We need to help find the box that's going to be the right fit for that person, not trying to force other areas on. That's great.
Oh, absolutely. And I think not to place blame, but a lot of times it's the doctors, the neurologists who, I'm here to treat epilepsy and that's all I'm going to focus on in this visit. And they forget that maybe the reason the patient is slow to communicate certain things is because of the other issues that are there. And, so the being flexible and being patient is it really matters.
Definitely.
Okay. So we've discussed some of the building blocks of strong relationships. Now I want to talk about some common relationship challenges associated with epilepsy. So for me, perhaps the most common relationship challenge that I encounter in talking with people with epilepsy and caregivers is the issue of overprotection. Caregivers understandably want to reduce the many risks associated with epilepsy and keep their loved ones safe, but the primary goal of people with epilepsy might be independence and full participation in life experiences, and the caregiver's efforts to keep them safe may come across as overly restrictive, as nagging, or even smothering. So how can families successfully strike a balance between the need for safety and the need for independence and self-determination?
Well, I want to start by just going back to referencing that whole concept of communication. I do think when it comes to the thought of overprotection and certainly wanting to keep our loved ones with epilepsy safe, we certainly want to do that as caregivers, as parents. We want to make sure they're safe. We want to make sure they're going to be supported and everything else. But at the same time, that individual, also wants to very likely be as independent as they possibly can and be able to do things too, that give them joy and meaning to life as well. And so I personally feel like there's definitely a delicate balance in finding ways to move forward and do the things we want to do in life, and at the same time, have some protections in place to make sure this individual is going to be safe and well cared for. I in situations like this, I find it really helpful, especially with older children, teens, and adults, to really go back to, again, those effective communication tools, talking about, what is it I want to do, being able to encourage people to, focus on the topic that they're discussing, really speaking clearly and from their heart to one another. What is it that I want? What is it that you want? How do we find a way to kind of meet in the middle and do that in a respectful conversation manner? I feel like you can get a whole lot further if everyone is listening and being open to listening and hearing what each other has to say. So for me, a big part of that comes down to making sure that there's really good communication between the individual and the caregiver, and trying to find a happy medium that's going to meet everyone's needs. There's a lot of anxiety that can certainly build up in caregivers when they're sending their child with epilepsy off to camp or off to do some of these different things that, the individual may really want to do. And at the same time, we've got to find those supports and services and make sure that needs are being met. And so I think that certainly having cohesive communication is such a key part in that. And also as caregivers and parents, being able to manage our own emotions and what we may be experiencing and some of those thoughts of either letting go or letting our child or young adult experience something new. I think there's not only interpersonal work that we do to support that, but also work within ourselves as well as caregivers and being able to help our children or young adults move forward.
Right.
Right. Well, and I think that certainly in a pediatric setting, you're going to hear much more, in regard to the issues of overprotection, because it's a natural reaction. If a parent is afraid that their child, if he rides his bike, is going to fall off and have a seizure, to a certain extent, you can understand that. But it often surprises me that even in our adult population here in the neurology department, an adult patient, maybe in their 30s or 40s, they come in with their parents who have become their caregivers, and the family dynamic is really, interesting, because it's the parents, and sometimes it's necessary if the individual has some limitations, intellectual limitations. But the parents have kind of set the tone. They take that individual everywhere. They can't go anywhere unless the parents are with them. They decide on medication. They decide on, on other things, and it just becomes a pattern that the patient, the individual in question, can't break after a while, because they're so used to having, their caregivers make all these decisions for them.
Right. Right, and I think another thing that's helpful for caregivers too is just really thinking through risk, because humans are notoriously bad at understanding risk, and just helping people think through, okay, how likely is it that this thing that you're concerned about and that you're preventing your child or your adult child from doing, how likely is it that that's really going to happen, given experience or given what we know, and sometimes just really thinking through the risks and putting that in perspective can be helpful. I think also just acknowledging, that's part of the communication thing that you referenced, that just simply acknowledging where the other is coming from and validating that. Can be an important step to then move on to some sort of compromise. So, so in terms of caregivers of people who have more severe forms of epilepsy or multiple disabilities, caregiver burnout can be a consequence. What can be done to prevent or minimize caregiver burnout?
I think it's really important when we're thinking about caregivers and and what they experience day in and day out, I feel it's really important to make sure that while the caregiver is trying to meet the needs of others, it's also very crucially important that they're meeting their own needs as well, or making sure that their own needs are being met. I really encourage parents, whether it be of children or of young adults or whomever I'm working with, to make sure that, if they're at risk for burnout, that they're making sure that whether it be on a daily or even on a couple occasions per week, that they're getting in some time for themselves to do something they enjoy, to find some way to de-stress, relax a little bit, take the edge off, whether it be reading a good book, whether it be, going running every other day. Whatever it might be, I find it very important for parents and caregivers to make sure that they're getting some time for themselves, they're getting some time to be who they are, that they're getting some of those opportunities. And I know that that's much easier said than done, but I do really want to encourage everybody listening, make sure you're getting that time in for yourself, even if it's just a short bit of time. If you can commit to it and really practice it and be able to have some opportunities to just let your hair down and relax for a little bit, it can keep that burnout at bay quite nicely.
Right.
But it does take practice. It's a lot easier said than done, and I know that.
Yeah.
Yeah, and people become caregivers most of the time because they choose to. You're doing something for someone that you love, someone that you care about, so you don't have any hesitation. But as time goes on, and sometimes the situation, may become worse and there is more care required, one of the biggest obstacles, I think, for people is this sense of, but I have to do this. If I take time for myself, I'm being selfish. I can't do that. I must be available to this person at all times. And, the thing I always say over and over to most people, whether it's a spouse of, someone who has epilepsy, or whether it's parents of a child who has epilepsy, is if you don't take care of you, you can't take care of anyone else. What happens if you get so burned out that you can't function? Then who's going to step in? So sometimes they have to be helped to see that it's really important for self-care, because that enables them to, be available in a much stronger way for the person that they are providing care for. And, caregiver support groups are important. And there are a lot of those around in the community, in different organizations and facilities, and then they get to, kind of share things with other people and find out how they are coping. And everybody has to be able to find at least a little bit of time for themselves, just to kind of recoup and, gain their energy back to continue, caregiving.
Right. And in addition to having to find time and energy to care for themselves, they may also it's also important for them to nurture other relationships in the family. So whether it's a spouse or the sibling of the person with epilepsy, what are some strategies to make sure that all family members are getting enough attention and that there's not feelings of guilt or resentment or jealousy that can come from a person with epilepsy getting seemingly more attention than other family members?
Mm-hmm. I think it's really important to make sure that we are definitely putting in time and energy and work into the other relationships that we have within our family and our family systems. Finding time, and I know that that can be a hard and challenging factor for a lot of individuals. It is important to try to set some of that time aside. If it's, an evening out with your spouse, to just reconnect or to, have a date night, if it's being able to, spend some time with your other children and making sure that your, relationship stays in a positive direction with them. I think a big part of this comes down to at least finding times throughout the week where you can commit to, okay, this is the time that I am going to set aside and be committed to, spending time with my spouse or significant other, or spending time with my other children, or making sure that they're having some of my undivided time. And I think for a lot of us, if we can step back and just kind of look at our day-to-day interactions with others, with family members, with loved ones, if you can even carve out 5 or 10 minutes every day to make sure that you're touching base and being able to have a positive social exchange with those individuals, that really can go a long way. I also think that in terms of the emotional component, or dealing with some of the negative emotions that come out of having an individual with epilepsy within the family unit, sometimes, we do see, especially in children, where they're not necessarily always understanding what's happening, or why is it that mom is spending so much time with my sister and not with me, or trying to help kids understand the dynamics of the situation, being able to teach them about the medical condition, about what's happening, and trying to help build some understanding and awareness can be very, very helpful. For kids, a lot of times, especially, uncertainty is kind of scary, and a lot of unknown. And so giving them some good basic foundational information, I find to be really important in helping them understand what's happening and how everyone can move forward even within the family dynamic system. I think that's really important. And the same certainly holds true for extended family members. Whether we're talking about grandmas and grandpas or aunts and uncles, just having some really good opportunities to talk about and share what is everyone experiencing right now, and really building upon that level of awareness and understanding, I think, can be really helpful to try to keep relationships heading in a positive direction and helping others understand what the family or individual may be experiencing. I also think that going back to, communication, there's definitely a communication theme here. I think that's an important component to all of this as well.
Right. Yeah, I think communication underlies so much of what we're talking about tonight, and I think it's important for people to realize, parent, spouse, whoever the caregiver may be, that some of the negative emotions that they're feeling are actually normal reactions. It's just how they handle it that makes the difference. They may find, at times that they do resent the fact that they can't go and do certain things because they have to be here, for this person. But it's important for them to be open to allowing other people to step in. Maybe, letting a grandparent or an aunt and uncle or a friend, come in and spend an evening with whether it's a child or an adult, and feeling okay about going out and doing something for themselves. They need to see themselves as being important in the situation, not just the person that has epilepsy, but if you're the one that's caring for them, you need to recognize that you deserve to have that opportunity. Again, I think of a patient who was the third of 4 daughters and the only one, of course, that had epilepsy. And it wasn't until she and her younger sister were both in their 30s that her sister shared with her how much she resented her when they were children, how jealous she was of the time that the parents spent with my patient versus her. And she grew up feeling really kind of ignored. And it was a shock to my patient because she said, I had no idea that that's how she felt. Well, no, because they were kids and they were close in age, so she wouldn't have picked up on some of those cues. So, yeah, as Courtney said, this is where communication becomes important. That was probably something that, you know, would have, if it had been addressed much earlier on, would not have you know, become such an issue when they got older.
Right, right. Okay, so we're all interdependent. No one is able to thrive without the support of others. People with epilepsy, however, often have greater dependence on others for certain needs like transportation or finances or seizure first aid or other things. So having to repeatedly ask for help can influence one's sense of independence and self-esteem, and can sometimes lead people to feel like they're a burden to others, particularly if depression is involved. Do you have any suggestions for people with epilepsy and caregivers to help them lessen these negative impacts of having to depend on others, and maybe reframe the idea of dependence as instead interdependence?
Definitely, and I think that word reframe is really an important component of all of this. You know, certainly when we're talking about interdependence and we're looking at some of these types of supports that we may need to be successful in life, that certainly can feel negative at times. We can certainly lead to signs and symptoms of depression, and we can see that negative outlook, if you will, certainly when these types of things are happening. I find it important, especially with a couple of my young adult patients who do have epilepsy, and really looking at how I help them kind of frame some of this or think about some of this, and from what perspective. You know, while we certainly could spend a lot of time looking at things that we can't do successfully or we can't do independently, you know, trying to reframe that from the standpoint of, okay, what can we do on our own? What can we do with the support of others? And trying to reframe that in a more positive light, I find that to be very helpful with the individuals that I work with, just from the standpoint of being able to shift our thinking, because our thinking definitely impacts our feelings. And so if we're thinking about something negatively, that's just going to stir up some certainly negative emotions, and we're going to see that happen. If we can reframe it in a more positive direction, a lot of times those negative feelings don't crop up as much.
Right. Yeah, and people with epilepsy, especially if their seizures are not well controlled, are always dealing with losses. You know, the loss of independence, not being able to drive, and sometimes not being able to work. In many cases, not being able to go any place alone. And so, you know, that certainly triggers feelings of depression and feelings of anger, because you feel like, you know, something is controlling your life. But it's important, I think, for us to help people see that there are other ways that they can contribute in a relationship, in their family, in other areas that can be just as important. You know, just helping out around the house, maybe safely helping prepare a meal, doing things that don't, you know, require using, you know, sharp objects or, you know, anything like that, helping their kids with homework, taking care of some other things. Because what you don't want to do is, like, keep a running tally of who does what. I hear that all the time from people. Well, my husband does this, or my wife does that, or and I'm just here. Well, yeah, it's important to find the ways that you can help out as well, because no matter what you're doing, it is going to be a contribution in, you know, in his or her own way that they're making. Right.
And any suggestions on on how to be okay with asking for help, because I imagine that's a problem when you have to ask for help over and over again. You start to feel guilty about asking for help. How can you counsel people to be okay with asking for help?
I think we just have to, certainly support the notion and idea that everyone at some point has to ask for help. And while, yes, there may be situations where we're asking for help more frequently, we don't have to feel alone in that process, because everybody is doing that to some extent at times within their lives. And it really is about reframing that for them and how they're thinking about that.
Right.
And something that I say a lot or ask patients a lot is, when they bring up an issue like that, is, well, how would you feel if the situation was reversed and you were having to help, whoever it might be, and, their usual reaction is, oh, well, that's different. So they kind of have to realize that, and I think appreciate the fact that the people that are helping them are doing it because they want to and because they, care about them. And it's okay to ask for help. We all need to do it sometime.
Right. So people with epilepsy often face decisions regarding if, when, and how they should disclose their epilepsy to others. Obviously, this depends on the individual and the circumstances. For example, the factors affecting when and how you disclose to an employer may be very different from those affecting disclosure in more intimate relationships. Can you discuss some of the different approaches to disclosure and the various factors that determine which approach should be used in what circumstances?
Certainly. I think for every individual with epilepsy, being able to share about what they're experiencing, and it's a very big discussion. It's a very important discussion to have, but I also think that is something that that individual has the opportunity to have some control over and how they're able to think about and do that with others. I personally feel like this is an important thing to think about, first and foremost from a safety standpoint, where I mentioned, an employer in your question. If an individual is experiencing seizures frequently, or those that may be somewhat uncontrolled, those are some really important considerations that you do have to keep in mind and think about when we're thinking about, whether it be a relationship with someone else or being at work or going to school. Certainly the potential impact that seizures and or epilepsy could have within those environments, I think, is an important determinant in what we disclose, when, and how. Certainly for individuals where we're more concerned about seizures happening more frequently, or they may not necessarily be completely controlled, I think that discussion has to happen sooner rather than later, more than anything for a safety standpoint. When we're talking about more intimate relationships or relationships with others, that's certainly a discussion that's important to have. And at the same time, I think that the individual has to decide when that timing is right and when that feels right to them. Certainly there are some lots of feelings that go into, what will the other person think, and are they going to be understanding? There's lots of different thoughts and emotions that go into that component. And I do think in many ways people need to have, develop some rapport or some reciprocity with others before they are able to feel comfortable enough to share that information. So for me, I think a couple of big factors with this really relate back to the idea of safety and what's necessary to ensure that the person is going to be safe. And at the same time, what are they comfortable with, and when do they feel comfortable with disclosing that information? There are a lot of things in their lives at times that they're not able to control, and this may be one of those things that we do have to, give them some time and opportunity to share when they feel comfortable, as long as we're going to be safe within the parameter as well.
Right.
Yeah, I agree that the safety issue is a very important one. I know when I worked exclusively with kids, I don't hear it so much now, but there was always a fear on the part of parents. I don't want the school to know that they have epilepsy. I don't want to put it in their records that they take medication. And I think, we often have to help people see that there is, another side to that coin. What if they have a seizure in class? How are the other kids going to react? How is the teacher going to react? Because the teacher's going to set the tone. So if others realize that, okay, this is happening, but it's okay, they're going to be calmer. They're not going to react in a hysterical way or a frantic way. And I think it's going to maintain some a greater sense of safety for the child. Same in the workplace. When anyone says to me, well, I don't want my coworkers to know, or I don't want my employer to know. I think it's one thing if you've had a history of seizures and now they're well controlled and you make the choice that, people don't need to know about that. But if there's a chance that you're going to have a seizure on the job, you need other people to know what to do, how to react, to avoid making the situation worse. If they know that they just need to let you rest, or they just need to be there and reassure you while the seizure runs its course, as opposed to calling EMS or the police, it's much better for everybody. Right. And I think when it comes to disclosure with friends, as Courtney said, the timing has to be right. It isn't necessarily something you're going to mention the first time you meet them, but at some point it is going to be important to share with them and, communicate well, educate them about what's going on. That becomes important, but certainly being comfortable with sharing it all.
Right. Okay, so we talked earlier about attention problems and executive function. Probably one of the most common complaints among people with epilepsy is memory problems. And these difficulties can lead to misunderstandings in those who are less familiar with epilepsy, and it can also lead to recurrent tensions in close relationships. Some common challenges include difficulty remembering names or other information that people may have shared in the past, repeating stories or asking the same questions over and over again because you didn't remember that you told someone that in the past, forgetting scheduled social engagements or important dates like birthdays, or simply forgetting to maintain relationships like checking in on friends or calling them periodically. So what are some strategies for dealing with these challenges and the impact of memory challenges on relationships?
I think that, in terms of strategies, there are lots of things that we can do to try to support and reinforce memory and remembering things. In this day and age, we have so much more at our fingertips in regards to technology and lots of different tools, from the calendar on our iPhones to, setting up reminders and alerts to call a friend back. There's lots of different tools and apps and things that we can use, certainly to help us remember some of those components that we may be forgetting. And for individuals, when you learn how to use those, and if that system works well for you, that can be very helpful in just supporting those memory skills or things that we're concerned about being forgotten. I also think that being able to be open in, relationships, friendships, even relationships within the family system, being able to have some open discussion about that too, of, yep, things were forgotten, and I'm sorry that happened. It was certainly not intentional, but, this is a sign and symptom of the condition, and we're all going to do our best and move forward. And certainly continuing to have dialogue and good, effective communication, as we've kind of talked about all along, I definitely think that is a really cohesive and important component to continuing to keep relationships intact and to moving in the right direction. Certainly at the same time as trying to find some other supports that may be helpful in just maintaining memory, even if it's just jotting notes down on a notepad or using an app. I think there are lots of tools available now today, certainly to help support that. If we can find a system that works for the individual, that can be very helpful.
Right. And I hear a lot of friends and family members, complain and say that they're really irritated because the individual, can't remember something, or they'll say, well, you already told me that, or I thought I told you that like 10 minutes ago. How could you forget it? So there's another area where educating people about the fact that people with epilepsy have a higher incidence of memory issues is important. And, certainly, there's so many different opportunities with technology to stay on track with things. But some people aren't comfortable with technology. They aren't comfortable with computers or some of the handheld devices. They just don't feel that they can do that, and that might make them more anxious. So that, in cases like that, it might be making lists. It might be putting sticky notes up somewhere to remind yourself of something that you have to do, and just helping them to see that it's okay if they have to do that. And the other factor that's important is that when people are constantly being told, well, you're not listening or you're forgetting, then they become more anxious, and anxiety can really affect memory. I have so many patients that'll come in and say, oh, I think I'm getting dementia because I'm forgetting things. Well, the brain can only process so much before it starts to affect some cognitive skills, and memory is usually one of the first targets of that stress. So, it's important for them to also be aware of their anxiety level and be getting help with that.
Right. And I think, going back to disclosure, I think when you're disclosing, particularly to someone that you're going to be spending a lot of time with, disclosing more than just the fact that you have epilepsy or that in fact you may have a seizure, but that memory can be a significant part of that, and that, please be patient. This is something that happens. I sometimes forget things. It's not, don't take it personally. Those types of things can be really helpful up front. So epilepsy can be a very isolating condition. Stigma, fear of having a seizure in public, driving restrictions, and unemployment can all contribute to social isolation. What are some general suggestions to help those feeling isolated by epilepsy to increase their social interaction and build their social network?
I really encourage families impacted by epilepsy to look at what are the groups available in your area? What are the things that we can participate in where others will know and understand? I think that, as a state and as a community, we have so many options available now, which is wonderful for families and individuals impacted by epilepsy. And so even being able to find, a small support group nearby and just starting out that way where others are going to be a little bit more in the know and understanding, and being able to feel comfortable in that type of environment would be a really great first step in trying to branch out and to be a little bit more social. And so I really feel like it's an important thing to make sure that people are connected and connected with others to understand, and just being able to build upon that is really an important component.
Yeah, I totally agree. I think support groups are vitally important, both to caregivers and to the people with epilepsy, because they give you a sense of community. You meet people that are dealing with the same challenges that you are, and so you get more information, and you don't feel so alone. You don't feel like I'm the only one that is dealing with this. And I think it's really, really important that people remember that your epilepsy is something that you have. It's not who you are. There's a danger sometimes of identifying too closely with a medical condition or any type of disorder that you lose perspective and you only see that part of your life and everything becomes associated with that. And it's important, to have a different sense of your identity, and not let your epilepsy define everything that you do in your life.
Right. So absolutely, support groups can be helpful in connecting with others who have similar experiences, but also if you have a hobby or something that you're passionate about, and there's not going to be an epilepsy-specific welding group if you really like welding. So, go join a regular welding group, and you'll probably be able to, you can disclose your epilepsy if you want. If you, there are ways to be involved in the broader community and also have connections to the epilepsy community. And in addition, there are other conditions associated with epilepsy, like Brain Injury Association of Michigan, for instance, has an extensive network of support groups. There may be support groups related to autism if you have autism and epilepsy. So even if you're not able to find a specific epilepsy support group in your area, there can be other support groups with similar conditions that would be helpful too. Okay.
Yeah,
so,
and if I could just make one comment, when you mentioned hobbies, Russ, that made me think of people who are very involved with crafts, and the event that the Epilepsy Foundation has every year, Celebrating Abilities, where you're able to showcase what people with epilepsy can do. And for so many of them, it's not just important, for that event, but this is their hobby, or this is what helps them relax, or it's something that they can take pride in, and really enjoy.
Right. So we've discussed a lot of basic strategies for strengthening relationships, but in some cases relationships are strained to the point where professional help is needed. Can you talk just briefly about some of the therapeutic approaches to help people strengthen relationships?
Sure, there are lots of different ways and different theoretical orientations to they were talking about counseling, other types of support to really strengthen relationships and help to build more cohesive relationships. Probably some of the more common ones that we see today are more related to cognitive behavioral therapy, where we're really looking at how our thoughts, feelings, and behaviors impact one another, and being able to build some awareness with those and see that move in a more positive direction. Certainly building social skills and having some really being able to build self-awareness and really supporting some of those social skills development can be so important to strengthen relationships and strengthen the ability to interact and gain meaning out of the relationships that you have with others. That can be really very helpful. The last part I want to mention, certainly in a lot of the work that I do, I spend a lot of time working with parents. Marriage counseling is can be a very important component of it. There's some really great approaches out there that really work at strengthening marriage, and a lot of it through communication. And how do we build cohesive communication? How do we really build a cohesive marital team? And being able to address conflicts as they arise in more of a calm approach or a more positive manner. And so there are lots of different options out there, certainly for individuals to help build those skills and certainly to strengthen their relationships with others.
Yeah, I agree completely. I think, in the case of support groups, certainly one of the things that sometimes prevents people from getting involved is afraid that they are going to have to talk about themselves, or that they're, going to be expected to always contribute. And I know when I do any groups, I make it clear that, you can just come and you can listen, because you can gain a lot just from listening to how other people are handling things. And it's good for patients, it's good for caregivers. And as I said earlier, there is no one-size-fits-all when it comes to therapy. So the therapy has to be tailored to the needs of the patient. And people also need to keep in mind that all relationships, including a therapy relationship, it's chemistry. Sometimes it's just not the right fit, and that's not anybody's fault. It's not the therapist's fault. It's not the patient's fault. It just isn't a good fit. And so then you have to find someone that you can really feel comfortable with, because if you don't have that sense of trust and comfort and good rapport, it's not going to be a successful situation.
Okay. So before we open up to questions and discussion, do either of you have any final thoughts on this topic that you'd like to share?
I think, Russ, the theme we've heard a lot about is communication, and I can't reiterate that enough about how important really good cohesive communication is. And I think that's a skill area that everyone can always improve upon, and I would just encourage everybody to do some investigating, to do some reading about good, effective communication strategies, and really work to build those, because I think good communication can move mountains. It's amazing what can happen, and I think that's a really important part to any successful relationship.
Right.
Yeah, I think good communication underlies all of the different things that we've talked about tonight, and just learning more about it, becoming more aware of how you communicate with people, and also remembering that everything is a process. No quick fix. No, you can't flip a switch and change everything immediately. Practice and just, taking time and being patient is what results in effective changes, and both, for yourself and for the people that you're dealing with.
Right. And in terms of communication, I think it's also important for people to remember that it's not just the words you use, it's how you say things, the tone that you use. Mm-hmm. It's your nonverbal communication can really absolutely change the meaning. If you take a set of words and say them with one tone, or say them with one set of body language, and then say them with a different set, that can be completely different meanings. So and those are things that people often may not be aware of when they're communicating with others. They, say, well, the words I said were fine, but then forget about those other aspects of communication. So, okay, so we're going to go ahead and open it up for questions. So I'm just going to go ahead and unmute everyone just a second here. Does anyone have any questions? Anyone want to jump in with a question?
Well, this is Marissa, and I just would like to make a comment. I really enjoy listening and sharing in these conversations. They are always a good experience and good learning. And also I want to share that with the memory, what I do here at my home, my bedrooms are upstairs, and for myself to get focused, like if I have to take something upstairs and I put it on the stairs or on the banister to remind myself to take it upstairs, or when something have to come downstairs. So I share with my daughter about I see something and it jogs the memory, and then, oh, let me take this. And I'm learning to have everything in its place, be more organized, and that has helped me out a lot.
Absolutely. That's critical is organization, having spots for things. If you put your keys in the same spot every day, it's going to be much easier to lose them, right? So excellent. Thanks for sharing.
Great idea.
Other questions or comments?
I'm Harley Bonner. I notice with my epilepsy, I tell my husband the same story like 100 times or more, then I tell him the same stuff 3 times or more. How we can take care of that where I don't do it as much?
Okay. One thing that I might recommend is, when at the start of if you know you're going to tell a story, you can certainly say at the beginning, stop me if I've already told you this, or just a simple thing like that. I don't know if I told you this before, and then you can have an agreement where if he says, yeah, I think you told me that yesterday. Then at that point you say, oh, okay, thanks, and you move on to something else. I can say with my mom as an example, and she doesn't have epilepsy or anything, but she has a habit of telling stories again, and sometimes we'll go yeah, I think you told us that yesterday, and then she will still continue and tell the entire story in full detail. So simply, that's again a basic communication skill where you guys have kind of an agreement where I know I have this. You've done an important thing in that you recognize that you do that, and that's a challenge. So you can simply take steps to when you're starting to tell some things, say, oh, stop me if I've said this before, and then Andrea or Courtney, do you have any other suggestions?
I kind of building off of your idea, Russ, but I do have a couple of my clients use with their family members. We have some like hand signals or nonverbals that everyone has agreed upon, especially that way if you're out in public or if you're at a bigger function, it's not quite as noticeable or uncomfortable. And so, a little hand signal of, like a stop sign, something along those lines can be really useful in that regard too, as long as everyone knows what that means.
Yeah, and you don't want to make someone, feel badly, and, if the other person understands that, this is just part of, the fact that they have epilepsy, and so their memory, is affected, and just kind of gently, bring their attention to it without, being harsh or critical or impatient.
Right. Okay. Other questions or comments? Anyone have any? Feel free to share any strategies or things that you've done that have been successful in relationships, or also feel free to ask other participants on the call questions. You don't have to necessarily ask the speakers questions. You can ask, hey, has anyone else struggled with this, or that kind of thing. So other questions or comments?
Yes?
Yeah.
This is Greg Schultz. Back when I went to school, I always had a hard time with my grades, and my dad said I wasn't trying hard enough in school. So, any comments about that or not?
Well, I do think that is, unfortunately, that's something that happens in a lot of relationships with epilepsy or other conditions that can affect cognitive function. It is the tendency from others, particularly those who don't understand epilepsy, to attribute any difficulties you're having either in the workplace or in school, to misattribute that to a lack of effort or a lack of motivation rather than legitimate memory and attention issues that make it significantly harder for you. So, and I think that happened. I've heard many times where that can happen in the school because someone, a student may have an IQ in the normal range, and maybe they do really well on one test, but then they have a seizure the next day, and there's a recovery period, or maybe they're having a bunch of seizures, and that next week they have tests and they do really poorly, and they say, well, last time you did so well on the tests, it must be that you're not trying hard enough, rather than recognizing that cognitive function can wax and wane with epilepsy, and it's hard for a lot of people to understand that because they're just, that's not what people tend to think about when they think of epilepsy. They think about seizures and may not be aware of all of the other components that are involved.
In a situation like that is where it would become really important for parents to share information with teachers so that they can look beyond just the performance itself and try to determine why there are problems and make choices about the kind of help that they can provide.
Certainly, and I think with my experiences in the classroom environment and in situations where we're talking about epilepsy and things do at times seem to wax and wane, that lack of understanding and that can really make a difference in terms of how a student is able to perform in the classroom environment and what strategies and supports that they need to be successful at all times. I think they're spot on. We need to look at what are the needs of the individual and how do we help them move forward.
But the principal, I always told my dad that I was putting on too in school when I had those things.
Yeah, and that's still unfortunately something that still happens occasionally, that people will think that people are faking their seizures to get out of having to do work or that kind of thing. Certainly something that's even more common in people who have psychogenic non-epileptic seizures. That's a very prevalent misconception, is that these are somehow voluntary events and that people are doing it to get attention or that kind of thing, which is absolutely not the case. There's a lot of misunderstanding, and that certainly again reinforces why it's so important when you're educating others about epilepsy to really take the time to fully explain it and touch upon some of those things that people may not already understand about epilepsy. Other questions? We have a couple more minutes.
This is Hannah. I have a question. One of the speakers had referenced getting training regarding executive functioning or social skills, and I'm kind of curious about where you would look into getting something like that, just to understand better what the challenges are, how those play out in real life, and what to do about them.
We're seeing more and more come out in regards to executive functioning, specifically within the psychology community, but we're seeing that more even in the educational community too. And so just kind of putting your feelers out and looking at potential conferences that come to your area that might touch on some of these different topics. There are lots of different speakers and lots of different organizations that are kind of making their way around the U.S. doing different talks. So I think that certainly looking at that There's a couple of different clinics that specifically just target and treat or target and educate, if you will, about executive functioning. One of those is Cognitive Connections. So just and just looking up their website, and you can gain all kinds of information about executive functioning. They have some really great information that we're seeing more and more of, and certainly learning more about, which I think is really exciting.
Are they in Michigan, do you know?
They are not.
Okay.
They are not. I believe they're in North Carolina.
Okay. Did you have another name of an organization?
That's the primary one that I've done a bunch of training through.
Okay.
I do know that, trying to think of some of the other seminars and things that I've seen come through.
There's a website, Attitude magazine. It's ADD magazine. It's a website, and they have podcasts and other information on ADHD, but ADHD is often very closely connected with executive function. So that's another resource for like listening to podcasts and other links to other websites that might be helpful. Courtney, what type of professionals or practitioners can provide sort of one-on-one assistance with executive function? I imagine like occupational therapists, speech language pathologists, neuropsychologists, and psychologists all might do that. Are there any that particularly would be, or any differences in their approaches to dealing with that, or?
It sometimes can come down to certainly theoretical orientation or what the person is really targeting. And for example, in our practice, our speech and language pathologist is also trained in some executive functioning techniques, but she approaches it certainly from a language-based perspective, where I may view things a little bit differently. Certainly your specialty has something to do with the way that you look at it, but certainly occupational therapists, speech and language pathologists, psychologists, even some social workers, depending on their background or what they're targeting, those would be, really good individuals that you certainly could go to and look at. Do you have specialized training in working on executive functions? There certainly are people out there that do specialize in that. And so finding someone in your area that might have to do some asking around, but those are the types of professionals that I would be looking at for that type of support.
What sort of training is that they take? Like if I were to find a university that had that sort of training and say, hey, where do your graduates go, so I can look them up?
A lot. To my knowledge, I don't know of any universities that are really specifically digging into the concept of executive functioning. It's kind of one of those things that we as professionals go and get additional training in over the course of time. Okay. Yeah, unfortunately, there isn't, to my knowledge, a specialty or degree in that, but certainly finding someone who specializes in that or who has additional training in that would be helpful. Okay.
And I can also reference a couple of previous Learn and Share conference calls that we've done. We did one earlier this year on strategies and tools for managing cognitive problems, and we did talk about executive function for a fair amount of that. We also did one a few years back with a neuropsychologist that was on attention and executive function. So those might be worth listening to see if you can glean any additional information. Andrea, do you have any suggestions as far as like actual practitioners who can help on a one-on-one basis with executive function?
Well, no, I think Courtney was right on track there. Was saying it all depends on what your orientation is, and whether your interest lies in that area. But some of the specific people you mentioned, and certainly neuropsychologists are very much on top of that issue. The problem there is that most of them don't see people individually. They do the evaluations and diagnose the problem, but
right.
they don't always. But certainly a lot of rehab programs would, I think, have people that might be interested in that or practicing.
That's true. Yeah, the whole like brain injury rehab.
TBI programs.
Yeah, even if you don't have a brain injury, you might still be able to get that type of service.
Sure.
Yeah.
Sure.
Okay. Well, anyone have any super quick last questions? I don't want to feel like that someone didn't get a chance to ask a question. Okay. All right, so we're going to wrap it up, and I really want to thank you both, Courtney and Andrea, for your guidance and your information. It was really helpful, and I think we touched on a lot of the complexities of epilepsy and relationships, and hopefully this was helpful to everyone. So thanks everyone for participating. I want to remind you too, if you have further questions or need additional information, please contact us at 1-800-377-6226 or visit our website at epilepsymichigan.org. Thanks everyone.
Merry Christmas and Happy New Year.
Thank you.
You too.
Thank
Thank you, everybody.
Okay, bye.